Hello, I'm Stacey Cleary and I'm here with my colleagues Prue Morgan and Freya Munzel. We're going to give you an overview of our scoping review published recently in Developmental Medicine and Child Neurology. There's a wonderful team behind this work and we'd like to acknowledge and thank all of our colleagues involved in producing it. This mixed methods scoping review is based around participation in the important life situations of young adulthood, and it was determined through a process of consultation between our research team and CP Unite, an advisory group made up of young people with cerebral palsy. We use these life situations as the basis for our scoping review, and our aims were to better understand the preferences for this all-of-life participation.
So our inclusion criteria were publications from 2001 onwards relating to young people with cerebral palsy that either quantitatively or qualitatively looked at participation in important life situations of young adulthood. These participation foci were mapped to the ICF outcomes. We used a convergent integrated analysis framework, which allowed us to synthesize those results according to themes, and those themes were then mapped to the family of participation-related constructs.
There were 38 publications describing 32 studies which met inclusion criteria, and equal numbers of quantitative and qualitative publications. 2 publications were from lower to upper middle income countries, with all remaining publications from high income countries like Australia, Canada, and the Netherlands. There was data from 2,759 participants. The demographics included slightly more males than females, mean ages spanning the years of young adulthood, and a fairly representative spread of those who were independently ambulant compared to those who used mobility equipment.
Thanks, Freya. We found that claiming my adulthood was the phrase that overall described participation for young adults with CP, and it included this idea that young adults with CP already had a strong sense of identity and what was important to them, and they knew how they wanted to be involved and supported, but they had to work really hard and they had to advocate for this. And thinking about those key life areas, young adults with CP wanted to be involved in those. They wanted to explore and grow, to discover and to exercise choice. And they did this often while experiencing pain and often deterioration of function.
A close-knit circle of support, typically made up of parents, siblings, friends, or a partner, formed an emotional foundation for this period of upheaval and practical scaffolding while the structures of young adulthood were built. Capacity building and growing in autonomy, integrating acceptable support for the young person with CP, having well-managed and empowering healthcare, and the existence of welcoming and physically accessible environments were the structural supports and key enablers of participation for young adults with CP. Young people with CP wanted the opportunity to do the same things as their peers and participate in the life situations that define young adulthood, despite the many barriers they experienced to this. They wanted to be involved and to belong. They described the lack of confidence and experience with this, and a lack of relationship opportunities compared to their peers. They had questions to ask and skills to learn. They did not know who to ask for help to navigate friendships and relationships.
Overall, across the key life situations of young adulthood, young people had reduced attendance compared to their peers, and they had less involvement compared to their preferences. And using the life experience of friendships and relationships as an example, the environment acted as a significant barrier to those who wanted to participate in events in the community, particularly for those using a wheelchair. Having to think about transport, choosing a mobility device to suit the weather, the activity, or their fatigue level, and whether or not food that was available would be safe to eat added a huge energy cost to planning and attending. And thinking about the context, people's lack of knowledge about disability also made participation quite difficult, and communities were often experienced as negative and exclusionary. And all of this was felt to be frustratingly unacceptable to young adults with CP. When young adults were able to attend, they experienced difficulty in growing friendships and relationships, and isolation and loneliness were seen as common. When they were involved in meaningful friendships and relationships, they experienced joy, the feeling of belonging, and the opportunity to be a friend. Role models, mentors, and friends who also had CP were seen as transformational. Those relationships were transformational for the young adults.
So what are the implications of this review? Young people with CP need to be involved in the design of health and social systems to support their participation. They want to be involved across all areas of young adulthood. However, more information is still needed on the participation experiences, particularly of young adults with higher levels of impairment who may not have been able to share their experiences qualitatively. And also, we don't know a lot about young adults with CP in lower to middle income countries. Thank you very much for watching this podcast of our scoping review findings, and obviously we hope you read the full review at this link. Thanks everyone.
Thanks so much.
Thanks.